Now we are starting Advanced TCM. अब हम start कर रहे हैं अपना Advanced TCM. So there are lots of things, but I will be highlight few things. बहुत चीजें हैं जिसमें कुछ चीजें हम highlight करेंगे. In this course, this will be 45 days course, right? So we will be discussing that how to do the diagnosis by looking the face, observation of the face, and do the diagnosis and the treatment. चेहरे को देखकर कैसे बीमारियों के बारे में पता किया जाए और डायग्नोसिस करके ट्रीटमेंट किया जाए. Like we can see the various part of the face. हम इस इमेज में देख सकते हैं कि हमारे चेहरे के अलग अलग पार्ट अलग अलग चीजों के बारे में बताते हैं. The various part of the face explaining the different thing. For example, we can see many persons are suffering with a fever and they are getting some problem in the corner of lips, that is called febrile disease due to some disharmony in the kidney, right? So we have to balance the kidney. Okay, so lots of things we will be discussing. The region of the face, we'll be discussing about the liver, about the lungs, about the spleen, about the heart. हम चेहरे को देखकर हम कैसे पता करें कि क्या तकलीफ है और क्या इलाज होगा. We'll also looking the body, observation of the body shape, because as per the 5 elements, we are having different types of the body. हमारे body के अलग अलग प्रकार होते हैं. So do the observation of the body and do the diagnosis and treatment. Well, observation of the color complexion, like this lady is suffering with some problem on the face. Now we have to see the color and do the diagnosis and the treatment. Color को देखकर लाल है, काला है, whether the pigmented, black, brown is color. So we have to do the diagnosis and do the treatment. So observation, why? Seeing the movement, we have seen the many person are having facial paralysis and they are moving the eyes in a different way. आंखों की कुछ अलग प्रकार से मूवमेंट होती है. The person is having full body paralysis or tremors, rigidity, हाथों में कंपन होना, पार्किंसन की बीमारी हो जाना. तो शरीर की मूवमेंट को देखकर हम कैसे डायग्नोसिस करें और इसका कैसे इलाज करें. So we will be discussing these things one by one, step by step. Now observation of the head, face and hair and doing the diagnosis, हम केवल पिंपल्स को देखकर और उनके कलर को देखकर बहुत कुछ जान सकते हैं, पहचान सकते हैं, डायग्नोसिस करके भविष्यवाणी कर सकते हैं और उसका इलाज भी कर सकते हैं. So we can do the diagnosis and also we can do the prediction just by observation of the head, face and hair. Now observation of the female breast. The female breast, in the breast of the female, there lump. So where the lump is, the type of the lump, and what is the representation, means what is the meaning of that lump, what to treat. आखिरकार lump क्यों हुआ है और क्या करना होगा. लंप को ट्रीट करने के लिए हम जो प्रोटोकॉल बनाएंगे उससे लंप भी ठीक होगा और शरीर की गहराई में उससे बीमारी भी ठीक होगी. So we'll not only treating the lump or the breast cyst or the problem of the breast, but we are also working on the root cause. So we'll be doing the observation of the back and making the protocol for the various problem of the back, how to correct the alignment of the spine. स्पाइन का अलाइनमेंट हम कैसे ठीक करें, बिकॉज नाउ इट इज पीपल आर सफरिंग विद टू मेनी प्रॉब्लम विद द स्पाइन. Then observation of the eyes and doing the diagnosis by looking the eyes. The different part of the eyes are doing the representation of different things. आंखों के भिन्न भिन्न पार्ट अलग अलग प्रकार की बीमारियों के बारे में बताते हैं. आप सिर्फ पेशेंट की आंखों को देखकर जान सकें इसे क्या बीमारी है और उसका इलाज कर सकें. जस्ट बाय लुकिंग द आईज you can do the diagnosis. Suppose while looking the eyes, if you know, oh, this is the case of liver heat, then we know the treatment, how to make the plan. Okay. आंखों को देखकर हम बीमारी को पहचाने और उसका इलाज करें. So by looking the eyes, by looking the eyebrows, we can declare many things. Then the observation of the nail, नाखून को देखकर भविष्यवाणी करना और बीमारी के बारे में जानना और ट्रीटमेंट करना. But observing the nails, doing the prediction as well as the treatment. So these all are the part of advanced TCM. By looking the lines in the palm, the lines of the palm are explaining many things about the health. हाथों की लाइंस को देखकर ये जानना क्या तकलीफ है और इसके बारे में प्रेडिक्शन करना. So observation of the skin and by looking the color to find out what is the problem and how to treat it. आखिरकार इसे कैसे ठीक करें. हम 5 एलिमेंट के बारे में डिस्कशन करेंगे. So we are going to discuss about the 5 elements. So let's see here. So this is a very basic chart, but I will start from here. मैं यहीं से स्टार्ट करना चाहूंगा. So like we are having multiple sense organ. हमारे शरीर में कई प्रकार के सेंस ऑर्गन होते हैं. Like the work of eyes. What is the work of eyes? To see the object. कुछ देखना, यही तो आंखों का काम है. Now if the eyes are getting affected, then need to treat the liver. Okay, the eyes are connected with the liver. और जब आप आंखें चेक करते हो, when you are looking the eyes, oh, something is wrong, kindly check the liver, because we know in the jaundice there is a problem of the eyes. The red eyes, oh, liver heat, more fire in the liver. आंखें लाल हो गई है, यानी लिवर की फायर बढ़ गई है. Okay. Yellow eyes, oh, yellow eyes, there is something, yellow pigment, jaundice in the liver. So eyes are the mirror of liver. So by looking the eyes, we are trying to find out the condition of liver, and by treating the liver, we can improve the eyes. So if you want to treat any person for the vision problem or the macular degeneration or the retinitis pigmentosa or any problem which is connected with the eyes, then need to focus on the liver. तो आपको लिवर पर ही फोकस करना होगा आंखों की किसी भी बीमारी को ठीक करने के लिए. Now regarding the ear, the ear are connected with the hearing. कानों का संबंध सुनने से है. और कहते हैं कि कान मतलब हमारी बाहर की किडनी. हमारे शरीर में 2 किडनी अंदर होती हैं और 2 किडनी बाहर होती हैं. ये बाहर की किडनी. So ear are the outer kidney. So we are having 2 kidney inside, 2 kidney outside. So 2 kidney outside. So these are the outer kidney, right? So suppose someone is having problem, hearing disorder. Then what to do? Treat the kidney. Deafness, treat the kidney. Tinnitus, treat the kidney. कानों में कोई भी तकलीफ होगी, आपको किडनी का इलाज करना होगा. So ear is connected with the eyes. In the acupuncture, it has been told Bigger the ear means bigger the kidney. Smaller the ear means smaller the kidney. कहते हैं कि जब आप भगवान बुद्ध के कान देखते हो, जब आप महावीर के कान देखते हो, बड़े बड़े कान हैं. Lord Buddha, Lord Mahavir having bigger ear. What is the meaning of that? Bigger the ear, bigger the kidney. Kidney बड़ी है, बड़ी kidney का क्या मतलब है? The meaning of bigger kidney means kidney essence. If you are having bigger ear, means your kidney essence is more. Smaller ear, kidney essence is less. Ear problem, treat the kidney. Ear is the outer kidney. कान बाहर की किडनी. So कानों का संबंध है हमारी किडनी से. So these are connected organ with the kidney. The third one, the third is the nose. The work of nose to smell the object. And nose are the part of lungs. तो नाक का काम है सूंघना और इसका संबंध है हमारे फेफड़ों से, लंग से. तो नाक में होने वाली कोई भी प्रॉब्लम के लिए आप क्या ठीक करेंगे? आप लंग्स का इलाज करेंगे. इफ द पर्सन इज हैविंग नेजल पॉलिप और नॉट एबल टू स्मेल, treat the lung. So this is connected with the lung, right? In the COVID pandemic, we have seen when the person were suffering with the lung disorder, many person got problem in the smell. कई लोगों को नाक से स्मेल चली गई कोविड पैंडेमिक में. Why? Because of lungs. So nose are the part of lung. So each and every sense organ having connection with one yin organ, हमारे किसी न किसी yin organ से जुड़ा हुआ है. Now regarding the mouth, whatever we are eating with the help of mouth. So mouth is for taste. मुंह का काम है स्वाद. So if someone is having the problem of the taste, someone is not able to taste something. किसी को खाने में स्वाद नहीं आता. Need to treat spleen. Spleen means taste. मुंह में स्वाद नहीं है, खाने में स्वाद नहीं है. There is no taste in the food, or your taste buds are not working properly. Treat the spleen. So in that way, these are the main sense organ. Other than that, these are the main orifice. ये हमारे मुख हैं. हमारे जीभ का भी काम है स्वाद लेना. जीभ का भी काम है स्वाद लेना. Tongue is also connected with the taste, and tongue is connected with the heart. Have you seen the tongue of माँ दुर्गा, माँ काली? माँ काली की जीभ किसने देखी है? चित्रों में, फोटो में, बड़ी जीभ, tongue out. What is the meaning of माँ काली? The meaning of माँ काली means great young energy, the red energy, heart energy, fire energy. So the person doing worship of the माँ काली, they are getting great young force, young energy. Because tongue is fire, it is coming out, red tongue. Okay. So tongue is the senses who's connected with the heart. Bigger the heart, bigger the tongue. Smaller the heart, smaller the tongue. What is the meaning of bigger the heart? Bigger the heart means if the person is having more energy in the heart, he can take the big tongue out. He can bring the big tongue out. अगर किसी के हार्ट में बहुत ऊर्जा है, कभी कभी ऊर्जा बहुत बढ़ भी जाती है, तो जीभ बड़ी लंबी बाहर निकाल देगा. Bigger the energy in the heart, bigger the tongue is coming out. And smaller the energy in the heart, if we ask the patient bring the tongue out, he will be doing like this. Okay, bring the tongue out. He will not able to bring the tongue out if there is a poor energy in the heart. So tongue is connected with the heart. So we'll be discussing the treatment. After a few days, we'll start doing the discussion of the treatment. Now, urethra is the opening of the urine. पेशाब की जो ओपनिंग होती है जिसे यूरिथ्रा कहते हैं, इसका भी किडनी से संबंध है. And the anus is also connected to the kidney. Remember one thing, all the lower holes, मल मार्ग, मूत्र मार्ग, योनि मार्ग, पुरुषों और स्त्रियों का जेनेटल मार्ग, जितने के नीचे के जितने होल्स हैं, सब किडनी से जुड़े हुए हैं. All the holes of the lower part, all the orifices of the lower part are connected with the kidney. So kidney control the anal route, kidney control the urethral route, kidney control the vaginal route. If kidney is poor, अगर किडनी कमजोर हो गई तो मल पर नियंत्रण नहीं रहेगा. व्यक्ति सुबह उठेगा, उठते ही भागेगा कहां? वॉशरूम की तरफ. Person as soon as get up in the morning will be running to the washroom. Need to focus on the kidney. As soon as you're feeling, oh, urine, oh, urgency of the urine, you have to run for the urine. Need to focus on the kidney. Kidney is controlling all the lower holes. No control on the genital path, vaginal discharge, white discharge. Need to focus on the kidney. किडनी पर फोकस करना होगा अगर कोई भी गड़बड़ होती है. तो ये हमारा एक बेसिक. Now the very, very important thing here. Now some physical and psychological relationship of the organ. So look at here. So आपने देखा होगा कई लोगों को बार बार गर्दन में दर्द होता है. Many person are suffering with the frequent neck pain. If the person is having frequent neck pain, so neck is connected with the disharmony of the liver. Remember always, there might be liver chi stagnation. There might be liver yang rising. तो जब भी किसी व्यक्ति को बार बार गर्दन की तकलीफ हो, कभी कोई बोले गर्दन में दर्द है, गर्दन में स्टिफनेस है, इसका संबंध लिवर से है. लिवर में ही गड़बड़ होगा. One lady came to me with the stiff neck like this. Doctor, since yesterday night my neck is stiff. Then I asked what, why, how it happened. She told, yesterday night I was too angry. Angry means liver. After the anger, my neck got stiff. So neck is connected with the liver disharmony. अब आप neck का इलाज कर रहे हो और liver को भूल गए तो कभी ठीक नहीं होगी पूरी. This is the root diagnosis of the TCM. It might be liver heat, it might be liver blood deficiency, it might be liver stagnation, it might be liver blood stasis, anything with the liver, connected with the liver. लिवर का कुछ ना कुछ कनेक्शन जरूर मिलेगा, तभी होगी गर्दन की तकलीफें. One lady told me, doctor, I am having all the time neck pain and in the x-ray I have cervical spondylosis, कि हमेशा गर्दन में दर्द होता है. रिपोर्ट में निकला है सर्वाइकल की प्रॉब्लम है. Now please treat it. Now do the treatment. Okay. Then we checked the lady, we found, oh, she is having the problem of the liver. As per the TCM, liver blood deficiency, उसे liver blood की कमी थी. Now suppose just I am doing the treatment on the neck. Oh, this is the UB meridian. Oh, this is the DU meridian. Okay, done. It will be only symptomatic relief. The person will never be getting cured 100%. Until and unless I treat the root cause, there will not be 100% benefit. Today, one patient came, doctor, I am suffering with the erectile dysfunction. मुझे erectile dysfunction है. Also neck pain. Then again I checked, he is suffering with the liver yin deficiency. So right now just focus on the liver. Now yin deficiency, blood deficiency, these things you will understand later on. बाकी चीजें भी समझ में आ जाएंगी. अभी इतना तो समझ में आए कि गर्दन का संबंध किससे है गर्दन का संबंध. Who is connected with the neck? Liver. Got it? Clear? आवाज आ रही है ना? आवाज आ रही है? Okay. So the point number 2. If the person is having the problem in the chest, it's a very normal that you know this is the problem of the heart. Okay, there is no problem with that. You already know that. अगर छाती की तकलीफ है तो पता ही है कि हार्ट की प्रॉब्लम हो सकती है. चलो ये ओवर. नाउ if the person is having disharmony in the lung, अगर व्यक्ति को लंग में तकलीफ है तो वो आएगा आपके पास अपर बैक के दर्द को लेकर. अपर बैक, the frequent pain in the upper back is due to lung disharmony. It might be lung heat, it might be lung stasis, it might be any problem which is connected with the lung. The person is having pain here, upper back pain, here, upper back pain, the upper trapezius muscle pain. Then doctor, I am having pain here in the upper part. And very frequently, that is due to lung disharmony. Now start doing survey. Whenever someone telling you that I'm having upper back pain, today one lady came, doctor, I am having too much pain here. Okay, do you have some problem in the lung? She told no. Okay. But she was sitting in front of me and doing like this. What is that? Oh, I always have little cough. So cough in the feet or cough in the brain or cough in the ear or cough in the eyes, cough in the lungs. Oh, doctor, I am having this problem after the COVID. COVID के बाद ये चालू हो गया. She was having upper back. And she started the upper back pain after COVID, after when I saw the tongue, जब मैंने जीभ देखी तो जीभ में कहते हैं कि जीभ का जो टिप होता है, वंचुन area of the tongue, that is lung. It was pigmented and black. Maybe I'm having tongue. It was fully pigmented, and so she was suffering with a pain in the upper back. I declared that you are having disharmony of the lung and the liver. You can see this in this image. If you see the tip of the tongue, you can see the pigmented spot till the 1 inch area down. अगर आप इस जीभ में देखेंगे, so look at the tongue until the 1 inch area down till here you can see. Till here you can see the pigmented part, whether you can see or not. Done? Got it? So upper back pain is connected with the lung. Now, what is the treatment? Treat the lung. Treat the lung for upper back pain. But she was having severe lung stasis. उसे लंग स्टेसिस थी जिसके कारण अपर बैक में पेन था. Now, if the person is having the problem in the thigh become very big, it's because of the kidney problem, kidney deficiency. Many person having pain in the thigh, that is due to kidney deficiency. One lady always having thigh pain, always. She is having very highly insecure feeling from the side of husband. Okay, husband is having some extramarital affair, and she is having very great fear of losing the husband. Always lives in the fear, in the insecurity. तो फीमेल को हमेशा थाई में दर्द है, और हमने जब देखा कि उसे हमेशा एक असुरक्षा की भावना है उसके हस्बैंड की ओर से कि ये छोड़ सकता है उसे. When the person is living in the insecurity, असुरक्षा की भावना में जब कोई व्यक्ति रहता है तो किडनी कमजोर हो जाती है. It creates thigh pain. So remember, the pain in the thigh is connected with the kidney. Now the most important thing, and we should all be aware with this thing, हम सबको ये जानना चाहिए, spleen is connected with the spine. If the person is suffering with the problem of the spine, just you use the spleen 3 every day, it will strengthen the spine. अगर किसी भी व्यक्ति को रीढ़ की हड्डी की तकलीफ है, हमने देखा है slip disc, spleen, the problem of the vertebra, spleen. If the spine is straight, means your spleen is wonderful. So when we are doing meditation, we are telling, okay, sit straight, erect your spine. If your spleen is good, you will be like that. But if your spleen is weaker, you will be. Spleen is making you erect. स्प्लीन का संबंध है आपको सीधा खड़ा करने से, right? Now, if you want to read the spine, you cannot forget the spleen. Otherwise, you will not able to repair the disc, the desiccation of the disc, the drying of the disc because of the disharmony of the spleen. जब desiccation होता है, drying होती है, तो वो spleen की disharmony से होती है. So neck is because of the liver, upper back is lungs, shoulder junction. It might be because of the liver as well as the lungs. तो गर्दन तो लिवर से है, पीठ हमारी लंग से है, कंधे तो दोनों से हो सकते हैं. Spine is connected with the spleen, thighs with the kidney. थाई का संबंध हमारी किडनी से है. So look at this chart. This chart is very helpful. So neck is connected with the liver, chest with the heart, upper back and shoulder with the lungs, thigh and lower back with the kidney, and spine with the spleen. This chart is explaining everything very, very accurately. हर चीज के बारे में बहुत ही शानदार डिस्क्रिप्शन आप देख सकते हैं इस चार्ट के अनुसार. Clear? So you want to treat the lower back? Okay, treat the kidney. You want to focus on the shoulder? You can focus on the lungs, but I told you it also might connect with the liver. But lungs and upper back primarily connected with the lungs. हमने बहुत पेशेंट में देखा है, if the patient is having restricted movement of the shoulder, that is because of the lungs. Okay, frozen shoulder connected with the lungs, right? So let's proceed. It's clear to all anything, whether the axis, see, any problem in the lung heat, lung deficiency, lung stasis, excessive energy in the lung, poor energy in the lung, they will affect. If it is clear, then proceed ahead. सभी को clear है, सबको clear है. Let's proceed now. So now this another chart. The 5 yin organ: lung, spleen, liver, heart, and kidney, and their connection with the tissues. Let's talk about the lungs. Lung is connected with the skin and open in the pore. Very important thing. बहुत महत्वपूर्ण बात है कि लंग का संबंध हमारी स्किन से है और ये पोर्स में ओपन होता है. Now think about this. Suppose this is the skin. So lung is connected with the skin and opening in the pores. So lung, actually the energy of the lung found between skin and muscle, because this is the skin, deeper inside the muscle, their lung energy found, which is opening the pore, closing the pore, opening the pore, closing the pore. If the lung is powerful, everything is good. अगर लंग मजबूत है, सब कुछ अच्छा है. But if the lungs are poor, weaker, then not able to control the pores, then person will be sweating a lot. Sweating a lot. Because no holding power over the pores. तो लंग का काम है चमड़ी को और पोर्स को नियंत्रित करना. और अगर लंग नियंत्रित ना कर पाए, कमजोर हो गए, तो पोर खुले रहेंगे, पसीना निकलता रहेगा. Remember one thing, if lung are poor, lung are weaker, so person will keep on sweating. If the lung become disturbed, sometimes pores are closed tightly, not opening. So anything happening with the pores, we need to treat the lung. Suppose person is not at all sweating, किसी व्यक्ति को पसीना ही नहीं आ रहा है, पोर ही नहीं खुल रहा है, तो हम जाके लंग 7 को सेडेट करते हैं। भाई लंग को बोलते हैं ज्यादा ताकत मत दिखाओ। लंग बोलता है देख ले मेरी ताकत, पोर को बंद कर दिया पूरे। लंग ने कहा ना, दिस इज ना, आई विल शो माई पावर। सो द excessive energy of the lung, what is the meaning of excessive energy? Means more contraction, then pore will be contracted, no sweating. Then sedate the lung 7. So lungs are connected with the pores. If lungs are too stronger, then they will contract, no sweating. And lungs are loose, sweating, too much sweat. So lungs are connected with the skin. Someone is suffering with the problem of the skin, you need to treat the lung. अगर किसी को स्किन की तकलीफ है, आपको लंग को ट्रीट करना होगा, like the psoriasis, eczema, itching, any type of the skin disease, need to treat the lung. Now spleen. Spleen is connected with the muscle. Many people suffering with the pain in the spleen, too much pain in the spleen. Even the heart is made by spleen. That's why heart is pumping the blood 24 hours. Our whole body is with full of muscle. हमारा संपूर्ण शरीर मसल से बना हुआ है। एक व्यक्ति जिम गया और जिम में उसने कहा, उसने 100 डिप्स लगाई, 100, तो भी हड्डियां बाहर दिख रही हैं, कोई मसल नहीं बन रही, नो बाइसेप्स, नो ट्राइसेप्स. Another person just after 20 dips, 20, oh, biceps came out, triceps came out. It's all about the spleen. Spleen is stronger, you will be having more chances to develop the good muscles. Spleen is poor, then it's very difficult to develop the muscle. बहुत मुश्किल है इस मसल को डेवलप करना अगर आपका स्प्लीन कमजोर है. And it's not about only the developing the muscle, even the muscle pain. Suppose someone is having all the time muscle pain, oh, paining, then we are going to the medical store and we are getting muscle relaxant spray, muscle relaxant spray. So muscle are connected with the spleen. अगर किसी व्यक्ति का स्प्लीन कमजोर है, उसे हमेशा मसल में दर्द बना ही रहता है. स्प्लीन को मजबूत कर दो भाई, स्प्लीन की ताकत बढ़ा दो तो मसल का पेन कम हो जाएगा. आप लोगों के कई प्रश्न हैं, आप चिंता मत करिए, आपके सभी प्रश्नों का हम जवाब देंगे. पहले कुछ बेसिक चीजें तो पढ़ लें, है ना, फिर जवाब देंगे. अभी तो बहुत बेसिक चीजें पढ़ना बाकी है. Still we have to discuss very basic things, then we'll reply questions because everything is coming soon. Then regarding the liver is connected with the sinus. Sinus means whatever is there in between the joints, whatever is there in between the joints, like the ligaments, like the tendons, like the cartilage, all connected with the liver. But especially ligament and tendon. लिवर का संबंध है लिगामेंट से, घुटने के बीच के लिगामेंट. यानी लिवर का काम क्या है? लिवर का काम है मूवमेंट देना. I want to move my elbow. So here there are lots of ligament tendon. They are giving very good support. This bone and this bone connected with the tendon ligament. So I can move my this elbow. So this ligament and tendon found in the joints under control by liver. That's why we are telling, okay, if you are having joint pain, then avoid eating the food which is sour in the taste. खट्टा खाना बंद करो. खट्टा खाओगे क्योंकि लिवर खट्टे को खट्टा से खट्टा खाने से लिवर एक्सेसिव हो जाता है. Liver become excessive if you eat the sour food, and it will create the pain in the joints, the pain in the sinew, the pain in the tendons and the ligaments. अब किसी को ligament rupture हो गया, the person got rupture in the ligament, then also you need to treat the liver. तब भी आपको liver को treat करना होगा. Now I would like to tell you one thing. Liver is also connected with the anger. Liver is connected with the anger. Liver is also connected with the suppressed anger. लिवर का संबंध गुस्से से भी है और सप्रेस गुस्से से भी, यानी दबा, गुस्सा दबा के रखा है, एक्सप्रेस नहीं कर पाया. So liver will become disturbed. If the liver will become disturbed, all the joint will become disturbed, all the joints, because liver is found in each and every joints in the form of tendons and ligaments. लिवर हमारे हर एक जॉइंट में. तो अगर कोई व्यक्ति गुस्सा करे या अगर कोई व्यक्ति गुस्से को बहुत दबा के रखे, दोनों परिस्थितियों में उसके जॉइंट गड़बड़ होने लगते हैं. नाउ these types of the person having more chances to develop the rheumatoid arthritis or the joint pain or the multiple joint pain in the future. इस तरह के लोगों को rheumatoid arthritis, joint pain होने की संभावनाएं ज्यादा बनी रहती हैं. So if you see the patient suffering with the rheumatoid arthritis, she might be having suppressed anger. 80% cases you will find, yes. Why suppressed anger is affecting the joint? Because joint means tendons and ligaments, and they are directly connected with the liver. So if you want to treat the rheumatoid arthritis, do not forget to treat the liver. अगर आपको joint को ठीक करना है तो liver को भूलिएगा मत. Heart is connected with the blood vessel. Heart का संबंध blood vessel से है. This is well known. And kidney is connected with the bones. Nowadays we are doing the great treatment of the kidney because most of the people having the problem of the bones, osteoarthritis, osteoporosis, osteopenia, हड्डियों में कैल्शियम का कम हो जाना, हड्डियों में कैल्शियम पूरा खत्म हो जाना, जॉइंट पेन होना, सब हड्डियों की तकलीफें हो रही. इसके लिए हम किडनी का इलाज करते. तो ये तो एक बेसिक डिस्कशन था आज. तो आज हमारा पहला दिन है. हाँ, अभी हमारी अगली क्लास कल होगी. सो नाउ विल मीट यू टुमारो. ओके. So slowly we will try to cover all the things which is required by all of you. Okay. Regarding the lemon, can we take the lemon? Yes, you can take lemon and see if it is creating the problem, then don't take. कोई व्यक्ति मुझे पूछे कि लेमन ले सकते हैं, मैं कहता हूं एक दिन लेके देख लो, तकलीफ है तो मत लेना. Because some person are getting problems, some are not getting, right? So how to strengthen the spleen, I will be discussing. आशीष जी, don't worry, हम समझेंगे कि कैसे करना है. प्रोटोकॉल के बारे में हम we will be discussing protocol. Okay, fine. Okay, so fine. So let's close the session now.